Good afternoon and welcome. You have joined the UMP Plus informational webinar. More specifically, this is the informational webinar about Puget Sound High Value Network, one of the two accountable care networks offered through UMP Plus. My name is Martin Teese, and I'm an account manager at the Healthcare Authority. I'll be kicking things off today before we learn more about the Puget Sound High Value Network directly from Andrew Kartunen, the network. First, a couple of technical matters. You can access sound through your computer, or you can use your phone. The number, access code, and audio pin can be found near the bottom of the audio panel. If you have questions you'd like to ask about the UMP Plus or the Puget Sound High Value Network, and from here on I'll call it the High Value Network, use the questions section on your panel to submit them in writing. We'll try to get to all of them during the latter part of the hour. This webinar is being recorded and will be available for viewing within a couple of days after the broadcast. Okay, we'll begin. First, a quick overview of the UMP Plus health plan. Why do we have a UMP Plus? Why should public employees and non-Medicare retirees consider UMP Plus? And might UMP Plus be a good fit for me and my family? So what is it? The Healthcare Authority manages a number of insurance options for the state's public employees. The Uniform Medical Plan, UMP, is the state's self-insured health plan for public employees. The UMP Medical Administrator is Regence Blue Shield. If you're familiar with UMP Classic, this was the original self-insured plan and remains popular for its broad provider network. UMP Plus joined the UMP slate of plan options in 2016. 2019 will be its fourth year. There are similarities between UMP Plus and UMP Classic. Like UMP Classic, UMP Plus is an offering of the Uniform Medical Plan administered by Regence. In addition, all the providers who participate in the UMP Plus networks are part of the Regence network. And like UMP Classic, UMP Plus enrollees can also self-refer to specialists. So what's the difference? We'll start with lower monthly premiums and annual deductibles. And just a note here regarding monthly premiums, there may be some variation between different employer groups. If you're unsure, check with your personnel, payroll, or benefits office. In addition, subscribers receive all network primary care visits without any out-of-pocket expense, and there's no annual deductible for drug coverage. Another significant difference is a consistent focus on coordination and quality, known as Accountable Care Networks, or ACNs for short. The two UMP Plus networks are geographical groups of providers dedicated to working together on behalf of plan members. As a plan, UMP Plus was designed to provide public employees with healthcare services through networks of providers who choose to work together to improve care. And they agree to be held accountable to standards for the quality of the care they provide. The providers who participate in the UMP Plus plan are, in turn, dedicated to preventive health care, consistent engagement with patients, and improving health outcomes. The High Value Network will elaborate on this idea in a moment. So why should you enroll in UMP Plus? First, you have access, and if you're changing from UMP Classic, you retain access to the Regence network of non-primary care providers. For example, you can access chiropractors, massage and physical therapists, and acupuncturists, just like a member does in the UMP Classic plan and with the same fees. Also, when you travel and have an urgent medical need, you have the same access as in Classic to the international Regence Blue Shield network. But a note here that only emergency and urgent care are covered at the network rate outside the U.S. Most notably, and once again, many find the UMP Plus premiums and contributions to be extremely enticing. This table is a comparison of the monthly premiums for UMP Classic and UMP Plus for each of the 4 categories: a sole subscriber, a subscriber and spouse, a subscriber and children, and a full family. Which one of these is your category? At the bottom of each column is how much you'll save annually in monthly premiums alone. For example, to the far right of the table, the annual savings for a full family, UMP Plus as compared to Classic, is nearly $1,900 just in premiums. Here are a few more figures comparing the 2 plans. You'll notice that the medical deductibles in UMP Plus are half what they are in Classic. And also that UMP Plus has no prescription deductible and no out-of-pocket for in-network primary care visits. So who is eligible for UMP Plus? UMP Plus is offered in a total of 8 counties for 2019 as listed here. You also must be an employee, a person with continuing coverage, a retiree with no one else on the account enrolled in Medicare Part A or B, or a COBRA member, also with no one on the account enrolled in Medicare Part A or B. Here's a map showing where UMP Plus is available for 2018. UMP Plus is the fastest growing UMP plan offering, and it grew by over 40% last year and 50% the year before. We anticipate much more growth as members experience the benefits of UMP Plus. Now, who might not be a good candidate for UMP Plus? Plus would likely not work for persons living outside of the UMP Plus counties. If there is an out-of-state college student in the family, for instance, or if anyone on the account spends portions of the year overseas or in Arizona, for instance. For them, UMP Plus as a geographical network might not be the best fit. So with that general information about UMP Plus, I'll turn it over to Andrew, who will tell you more about the Puget Sound High Value Network. Andrew?
Thank you so much, Marty. Good afternoon, everyone. My name is Andrew Cartoon. It's really my pleasure to tell you more about the Puget Sound High Value Network today. Marty, you did a fantastic job overviewing the health plan, the UMP Plus plan, and I'm here to talk about the network of providers. So, advancing the slide here. The High Value Network is a large network of high-quality healthcare providers who share a unified vision for providing high-quality care and service at an affordable cost. The network consists of 6 leading healthcare organizations spread across Washington state and includes Evergreen Health Partners, which is primarily located around Kirkland, Washington, in the east side of King County. Secondly, Multi-Care Connected Care, representing Pierce, Spokane, and Thurston counties. Overlake Medical Center, also on the east, in the East King area, in the Bellevue area. Seattle Children's Hospital, providing comprehensive multi-specialty pediatric care in the Seattle area. Signal Health, which is a clinically integrated network in Yakima County. And lastly, Virginia Mason Health System, who has a large network of providers in King, Snohomish, and Kitsap and Yakima counties. The High Value Network is offered to PEBB members in 7 major counties throughout Washington state. This includes King, Kitsap, Pierce, Snohomish, Spokane, Thurston, and Yakima counties. Only those members that live in these counties are eligible, as Marty talked about, to enroll in UMP Plus Puget Sound High Value Network. As a network of all-star providers, we are really focused on your health and wellness while ensuring a great healthcare experience that's tailored to you. Your care will be coordinated between our network doctors to ensure you receive the right care at the right time and at a low cost. As you can see here, 2 of our hospitals were recently named in the top 100 hospitals in the United States as measured by health grades. Others have been recognized by the U.S. News and World Report, and we've been distinguished by the Leapfrog Group and Washington Health Alliance for our patient safety and the experience that we provide to our patients. The High Value Network also provides some of the highlights as mentioned here, which include the 24-hour nurse helpline, the first clinic-based chronic care management program in the U.S., and one of the top bariatric programs among other items listed here. I skipped a slide, so I'm just going to go back here for a second and just talk about the fact that the Puget Sound High Value Network provides a comprehensive network of doctors and other health care professionals and have services that range from primary care to the most advanced specialty care. Secondly, we offer a large network of over 45 urgent care clinics across the state, and as Marty mentioned, are able to offer primary care visits, office visits at no out-of-pocket cost to you. If you do select UMP Plus Puget Sound High Value Network in 2019, we'd really like to stress the importance of primary care. The Accountable Care Network program functions best when you see a Puget Sound High Value Network primary care provider, and we would encourage you to select a primary care provider. This provider will coordinate your care with all specialists and hospital providers. They'll help you navigate the healthcare system and really advocate for your health and well-being. As an aside, we'd like to mention an important consideration specifically for members living in Thurston County. At this time, unfortunately, Puget Sound High Value Network is not offering adult primary care in Thurston County in the Olympia area. The nearest primary care options that we have for members living in Thurston County are in Lakewood and Tacoma in South Pierce County. It's important to note that primary pediatric and specialty care is still offered in Thurston County, as well as specialty care for adults. PEBB members living in Thurston County may want to consider the other health plan options that Marty mentioned earlier today in 2019. So across the Puget Sound High Value Network, this is a broad network of providers. We have over 1,200 primary care providers, 5,500 specialists, over 1,200 clinics, 16 hospitals, and as I mentioned earlier, 45 urgent care clinics, as well as a large network of emergency departments across the state. We also have a large network of trauma centers, home health and hospice agencies, and as I mentioned earlier, a 24-hour, 7-day-a-week nurse hotline for you to call, speak to a nurse, and seek a consultation on any urgent care needs. If you do join UMP Plus High Value Network, there are a number of services included for your benefit, including access to a dedicated call center, our website, and patient web portals that allow you to communicate and interact with your healthcare teams within the network. First, the dedicated call center can be reached at 1-855-776-9503, and they'll help you and your dependents schedule appointments, locate doctors, and answer any questions you have about our network. As you make a choice about your medical plan this year, we encourage you to call this dedicated line to answer any questions you may have, even if it's just confirming that your doctor is within the network. Secondly, you can go online to our website, which is the PugetSoundHighValueNetwork.org. Here you can access all the information related to our network and the UMP Plus Puget Sound High Value Network plan option. It's here that you can search for providers and clinics within the High Value Network and get connected with the resources available to access your care. So at this point, we hope that you choose us, UMP Plus Puget Sound High Value Network, so that we can serve you in 2019. And I'll hand it back to Marty to walk through how you can enroll during the month of November. Marty?
Okay, thank you, Andrew. Signing up for UMP Plus is fairly simple. First, you can always go to your payroll or benefits office for assistance. Just as easy and maybe a little faster, you can go to the PEBB webpage. You see that at the top, hca.wa.gov/PEBB. Then select your member type, and that would be public employee, retiree, continuous coverage, and then click on My Account, the green pill shape in the upper right. Log in with your email address and password. There are also forgot email and forgot password options at the bottom of the page if you get stuck. And this is the page you come to. This is where you start to change your plan during open enrollment every November. Go to the bottom of that page and click the green button. This is where you can select your network. Note that this screenshot depicts the UMP Plus premium, $50, for a single subscriber. You'll see the premiums reflective of your account, whether single, with a spouse, and so forth. Signing up for the 2019 plan year, your choices are the UW Medicine Accountable Care Network or, the subject of today's webinar, the Puget Sound High Value Network. After you've made your selection, be sure to click the green Continue button at the bottom of the page. This is the page that will come up asking you if the plan change information you've entered is correct. Be sure to double check, and if it's correct, click the green button at the bottom to confirm. Then you'll be instructed to print your confirmation page, which is a good idea. It's pretty simple. And remember, if you need assistance or have questions about how to do this, just reach out to your payroll or benefits office. Again, the annual open enrollment period every year is the month of November. So it begins this Thursday, November 1st, and ends on November 30th. Here are some contact links if you'd like to learn more about the Puget Sound High Value Network. At this point, we may have some questions, and I will hand it back to Andrew to facilitate the Q&A. Andrew?
Thanks so much, Marty. As Marty mentioned, we'll open it up for questions and have our Q&A portion of today's session. As a reminder, please use the questions section of the webinar panel to submit any questions you have. As we begin this Q&A session, we'd like to share with you a number of member testimonials that have been shared by current members of the Puget Sound High Value Network, as you can see on the slides here. So I'll kick us off. There's been a few questions thus far. I'm sure a few others will trickle in here. But first, Kristen had asked the question is, what is the difference between the UMP Plus High Value Network and University of Washington plans? So I'll start this one and then hand it over to Marty and Michael to answer from the Healthcare Authority perspective. So the only difference between the High Value Network and University of Washington plans is basically the network of providers that's included in those plans. First, we should note that you must choose one network or the other. You're not able to access providers within both networks. So we'd really encourage you to assess the provider networks within both of those networks to see if your doctor's within one of them, and if not, check the providers to see which ones might provide more convenient access based on where you live, Kristen. So otherwise, all of the other benefits that are provided within UMP Plus are the same across both networks. So the free office primary care visits, the low deductible, the $125 medical deductible are the same, as well as no prescription drug deductible, and the premiums are the same as well. Marty or Michael, do you have anything to add on that question?
I just want to echo, this is Michael Arness, who's the account manager for the UMP Plus, and both networks perform quite high quality medicine because we measure both of them. They both do well. They also both have very high retention for the members that have joined. the UMP Plus. Andrew, you hit it right on the head. The benefits are the same, the cost sharing is the same, and the services are the same, healthcare services. We'd really encourage people to look at the websites of both of the networks, or go right to the call centers and call people who are expert in the providers that they offer. And if you're interested in UMP Plus, select that set of network providers that is the one that best fits your needs as a subscriber, or the best needs of your family, and or is convenient to where you live. But thanks for the question.
Thanks, Kristen, for that question. Secondly, Jessica asked that there's no adult primary care providers in Thurston County. She asked, so those in their 30s would have to have a primary care provider that is in Lakewood or Tacoma. So, Jessica, this comes back to the fact that currently the Puget Sound High Value Network does not have adult primary care providers in the Olympia and Thurston County areas. If you do select us, the closest primary care options are in South Pierce, so Lakewood as well as Tacoma. And obviously, with us stressing the importance of primary care, we'd really ask you to look at all the options and see which one's the best for you.
Andrew, this is Michael again. The only thing I would add to that is that the High Value Network does have pediatric care in the Olympia area, as well as specialists in the Olympia area. It's just the primary care for adults that is in Lakewood and Tacoma as the closest providers. Back to you, Andrew.
Thanks, Michael. So moving on, Shannon's asked some detailed questions with respect to some upcoming care for bariatric procedures. There's a number of different questions here, Shannon. Michael, I might actually hand this one back to you to answer Shannon's question.
I think I will, and then Mandy Willis, if I could invite you in on this here. We do have a select few procedures that we have providers in the state that perform just those procedures. And we usually don't highlight those in the presentation because they're very special, and they don't come up too terribly often. But bariatric procedure is one of them. Mandy, if you're on the line, can you confirm that for us and let us know what the benefit?
Hi, this is Mandy. So this is a little bit of a detailed benefit. So I would actually suggest calling customer service. You can call the Regence customer service number, and they can assist with detailed benefit information. There are requirements prior to having the bariatric procedures.
And Mandy, those people can also help the member decide if there's any issues with switching from the plan that he or she has to the plan to UMP Plus. Is that correct? You could give some counsel on that as well.
Yes, that's correct. Important questions you'll want to ask are the provider that you will be seeing to do the procedure. Make sure that provider is covered in the network, as well as the facility in which the procedure will be completed.
Thank you, Mandy.
Thanks, Michael and Mandy. So moving forward here, Dan's asked the question of what number should I call to confirm whether my provider's within the network. And so Dan, to help answer this question, we really encourage you to call the network-specific dedicated call center. So that number is 1-855-776-9503, and the specialists within that call center will be able to confirm whether your particular provider is within the network. What could have happened here is, as Marty talked about, massage therapists, physical therapists, chiropractors across the state are often included in the UMP Plus option, and could be showing as a primary care provider. That includes naturopathic providers. So if you are seeing a naturopath, UMP Plus does offer a wide network of naturopathic providers to provide that service as well. Michael, anything to add there?
I would just echo, please call the Puget Sound High Value Network call center to talk about the providers in the Puget Sound High Value. And if we could, we might even be able to go to the screen that actually has the phone number on it while we go to the next few questions. There we go.
So Sam asked the question, when do you expect full UMP Plus benefits to come online for Thurston County residents? So Sam, as a network, from the network's perspective, we are always attempting to identify new providers to join our network. We've had some issues trying to identify them down in Thurston County due to the limited number, but what I will encourage you to do is if you do have a provider down in Thurston County, please do encourage them to reach out to us if they are interested in joining a network like ours. You often, as the individuals and the consumers of healthcare, can have a lot of leeway in pushing your providers to join accountable care networks like this. So while we're trying to identify providers all the time, I can't provide you a specific timeline at this point, but we're trying to meet the needs down there as much as we can. So Christina asked the question, it looks like there's no chiropractic option within Western Washington on UMP Plus. How does this affect my out-of-pocket expense? So Michael, and I might hand this one back to you and Mandy to answer just from a benefits perspective.
Yes, I'll be glad to start. There is the same chiropractic coverage in UMP Plus in Western Washington and Eastern Washington as you have in UMP Classic. And that is because all of the chiropractors that are in UMP Classic, the UMP Classic network, are automatically folded into the UMP Plus provider network with the options. If you'd like, I think probably the best thing to do to follow up with that particular question would be to call the number that is for High Value Network and talk to their contact center to discuss providers and to start there. It says it looks like there's no chiropractic option, so I'm not sure where you're looking, and I apologize if there's something out there that is confusing. But you do have very broad chiropractic options in UMP Plus.
And I'll add to that. This is Marty. I was in Classic for, goodness, about 15 years and really appreciated the offerings of that plan. And when I shifted to UMP Plus, that was my very question with regard to chiropractic, massage therapy, things like that. And the answer I received and what has been borne out, I have the same access to chiropractic and massage as I did in Classic. These are considered what are called ancillary providers, and you retain access to those if you're coming to Plus from Classic.
Thank you, Marty and Michael. So the next question is from Kristen. It appears to me that the providers offered in both the High Value Network and UW plans have multi-care connected care providers. Is that correct? And Kristen, yes, multi-care connected care is included in both UMP Plus accountable care networks. So you'll want to look at the other providers to help make a decision there. Leslie also asked, when searching for a provider via Regence, Regence's website, if they have a Puget Sound High Value Network provider or plan next to their name, can we assume that they're part of the network or this particular plan? So Leslie, I'll actually go into detail. So when you do access Regence's website and search for a provider, what you'll want to do is just confirm there's going to be a link on once you do search a provider to suggest what networks are accepted by this provider. When you click on that, it will show all of the different Regence provider health plans that are available through that provider. And if it does suggest UMP Plus Puget Sound High Value Network, yes, you can assume that provider's within network. Mandy, anything to add there?
Nope. I think you did a great job explaining that, Andrew.
So Jill asked a specific question about a UW provider. If there's a UW provider showing as in network for Seattle Children's Hospital. She also mentioned that if I saw that the provider is in an adult facility besides Seattle Children's, would that provider be covered? So Jill, without knowing too much more detail about these particular providers, again, I think we'd encourage you to go back to each of the network's websites to confirm the specific provider, as well as go to Regence's website to confirm the in-network status for those particular providers. I think if you could provide us a little bit more information around that particular question, we might be able to answer it better, or you can call our call center to confirm as well. Michael, any additional thoughts there?
I think it would be best to start with the call center, Andrew. Thank you.
So last couple questions. Kristen asked, is there any plan in the future to get Franciscan Health System providers included in either of the UMP Plus plans? Kristen, I think for 2019, it's not the intent for either network to include CHI Franciscan. We would encourage you to come back at open enrollment next year to confirm whether or not CHI Franciscan is part of one of the two networks. So I think that might be a possibility for 2020, but not for this particular enrollment year. The last question is, are all of the mental health providers that you can see if you have UMP Classic also available under UMP Plus as ancillary providers, just like chiropractors? So the answer to this question is yes, the same network of mental health providers are included, as Marty mentioned, within that ancillary support network. And you can assume that the mental health providers available within UMP Classic are also available within both UMP Plus options.
Andrew, if I could, I think the only slight difference in that reply might be in the area of an actual psychiatrist, which would be the MD level behavioral health professional who would be within your network. Other than that, all of the behavioral health providers, the counselors that would be seen in UMP Classic would be the same providers available to a member in UMP Plus. Mandy, can you
thanks for that clarification, Michael.
Yeah.
And we got one more question that just trickled in from Jim. Are the prescription medications covered in the same tiers across each of these plans? So, Michael, I'll hand this one back to you.
Yes, the actual medications themselves are the same across all three of the UMP plans, whether it's the Classic, the Consumer-Directed Health Plan, or CDHP, or in UMP Plus. For simplicity's sake, we use the same drug list and tiers. The only difference is that there's lower out-of-pocket cost sharing with UMP Plus. Mandy, anything that you would add to that?
No, thank you.
Back to you, Andrew.
Thanks, Michael. So that covers all the questions that have been asked by those attending today.
Andrew, this is
unless
Mandy.
there are any questions, we'll probably near the end of our webinar session today. Today's session will be recorded and posted to our website. So if you do have questions that you think of or want to come back to the presentation, we'd encourage you to go and access this webinar recording on our website. Secondly, as a reminder, open enrollment starts on Thursday, November 1st. There are a number of different in-person benefit fairs. I believe you as PEBB members should have received a schedule. And we'd encourage you to attend any of those benefit fairs or the one that's most convenient for you to answer any questions that you might have. So I'll leave my thoughts there and hand it back to Michael and Marty to close today's webinar.
Michael, before you do that, this is Mandy. May I correct one statement quickly, please?
Yes, please.
Thank you. So, Michael, you said earlier regarding mental health providers that mental health, with the exception of psychiatrists, are covered just as they are across the board with the other Regence networks, and that's incorrect. It's actually all mental health providers, regardless of the level of provider, including MDs. As long as they are a
Thank you.
Regence provider in the service area, they are covered in network.
I appreciate that so much, Mandy. And then if you could clarify for everyone as well, I believe the inpatient services for the hospitals that are in the network for behavioral health are also covered as well. Is that correct?
That is correct. Mental health facilities as well.
Good. So broader than I said. Thank you.
You're welcome.
It doesn't look like we have further questions coming in. Let's see. Okay, so that concludes our webinar for today. As Andrew mentioned, this webinar has been recorded and will be available in the next couple of days at the High Value Network site. And we appreciate your attending the webinar, and we hope you sign up for UMP Plus High Value Network. Thank you.